Now, we often talk about an extinction burst relating to behavior in ABA. I remember when my oldest son, David, who's now 20, he had massive extinction bursts in his first ABA program. And I cried a lot about that. Like, I used to sit outside the room with my little prayer book, and my heart broke into a million pieces that he was so upset. And, you know, parents tend to become concerned when they hear their child crying. It's only normal to want to console your child. What advice do you have to offer?
Yeah, like you said, it is absolutely normal to want to console your child. As a parent, that's your main job, is, you know, to make sure they're happy and healthy. So it's hard as a parent to think about the future when in the moment your child is so upset, but you really want to ask yourself, if my child is reacting this way, you know, as a teenager or as an adult, would that be okay? Because, you know, if they aren't learning the skills to replace that extinction burst, it's going to continue into adulthood. And at that point, it's even harder to manage that type of behavior. So most of the time, the discomfort, that temporary discomfort and heartbreak does pay off in the future. But, you know, there are still parents who aren't quite ready for that step yet. So I think it's also important to talk to the supervisor about, you know, how to better manage that extinction as a parent. You know, maybe it's making sure that we're only doing a specific lesson at the center and not at home, or, you know, letting parents know ahead of time, we're about to sit down and read a book. And, you know, we know that your child doesn't really like reading a book, but so they might cry. You know, just kind of preparing parents ahead of time, so they, you know, can hopefully be a little bit more okay with their child being so upset. But again, like at the end of the day, as a parent, you know, you guys get a say in how we do things. So if you're not ready for it yet, you know, talk to the supervisor, but it eventually does pay off.
I always tell parents that when you hear your child crying, you automatically think that
Yes.
they're in pain or they are in distress. But if they don't have another means to communicate, and they don't, even if they two, many children have double words, right? They should have double words, and that's how they should be communicating, in at least 2-word phrases. Now, if they are not capable of that level of communication, they're going to cry and scream to communicate. And that doesn't necessarily mean that they're in pain or that they are distressed. It just means that that's how they've now learned to communicate. And in the ABA program, we're working on teaching them the developmental skills to replace the crying and screaming. And I love what you said, because it's not going to go away unless we teach replacement behavior and have the time in ABA, you know, to teach the communication and language skills that they're missing. You're going to have a teenager who's banging his head against the wall. I experienced that with my oldest son, David. I mean, his teenage years were the worst. They were so bad that I had to write a book because I had to let other people know what we went through. It was really, really so hard. He would hit his head. He would fall down on the floor and kick and scream and bite and spit. So the sooner we can, you know, it's much easier to work with a younger child who's 2 or 3 years old, and they may cry for a certain period of time, but then they'll soon start to realize that when I communicate in a certain and appropriate way, I'm going to get my needs met. But I do agree with you. You as a parent have to be in the right space to handle it and to receive that intervention. It's not going to be for everyone. Now, I wanted to ask you, what is the role of a supervisor? Because at Star Academy, every child gets a case supervisor and then a team of instructors that implement the program. And I love how you used the word nurse, because I also explained to parents that the supervisor is like a doctor who's deciding on the ABA strategy and which skills to teach, and then the ABA instructors implement the program. Sometimes parents will say, but why do I need this supervisor? I don't want them. And in South Africa, we have to have a minimum of 4 hours of supervision every month once the case has been designed. But in America, I'd love to hear what the minimum supervision required is on your cases at CARD, and tell me more about the role of a case supervisor.
Yeah, so the supervisor, like you said, comes up with a treatment plan that helps reduce the problem behaviors and teach those important skills. We work with the families directly to decide what behaviors we want to work on and what skills we want to work on. Um, you know, the the supervisor trains families as well and trains the instructors on the individual treatment plan. They make the changes. They're the one that is able to create and make and adjust the treatment plan, because they have that additional training to analyze data and determine what changes need to be made. So the supervisor is incredibly important, even though they might not be working with the child directly. They have that expertise and training to know which way to take the treatment plan, and know how to work together as a team with the child, the family, and the instructors to make sure that it's all going in the right direction. As for supervision, for us, we try to aim for 10 to 20% supervision to therapy percentage. So that means that a child with 40 hours of therapy a week should get about 4 to 8 hours of supervision a week as well.
Wow. So
Yes.
that means that a child who's doing 7 hours a day is getting 4 hours a week. We're talking about 12 hours a month of supervision.
Yes.
Wow.
Right. Because there's just that treatment plan is a lot more comprehensive and requires more analyzing data, more training like with the behavior or the instructors. So that's why that's so high, versus, if someone's receiving like 10 hours of therapy a week, that's about 4 hours a month. Because there's not as much time or not as much data to analyze and, decision making that needs to be made. I will say though, again, every child, just like how every child gets an individualized treatment plan, the number of supervision is also very different for each child. Maybe a child with 10 hours a week might get as much supervision as a child that's getting 20 to 30 hours a week, depending on that specific child, if they have a lot of behaviors, or if they're progressing through their programs really quickly. It's really, really dependent on the child, but we do aim for that 10 to 20%.
It's so interesting to hear what you do in America, because it's so difficult for us to even cover 4 hours of supervision because there is no funding. So the more supervision, the more it's going to cost the parent. And so, wow, 12 hours a month of supervision is just something that we can absolutely strive for. Now, when does a child require an augmentative communication device? If we put a device in place for communication, does this mean that they're not going to speak vocally? My oldest son, David, he uses an iPad with touch chat to communicate, and he actually really does so. He communicates very successfully on the device. At what age would you start considering a device? And, I know parents are like so worried when we say communication device. Well, now my child's not going to speak vocally. What advice do you have to offer on that?
I would say the earlier, the better. Just remember, that communication device is a way for them to just express their needs, that, they were expressing. Either one, they weren't able to express at all, or two, using those problem behaviors to communicate what they're wanting. So it really just, it helps a child who has limited vocal abilities to still communicate. I just imagine myself if I was hungry, or if I wanted a specific, if I wanted to watch a movie, or, wanted to go somewhere and I had no way to get access to it, that would be frustrating because it would be something that I would have to deal with 24/7. So communication isn't the only way to fix a problem behavior, but it makes it so much more manageable because the child is getting their needs met. Not all children will be able to speak vocally, as much as we might want that to happen. there are a lot of factors that go into it. If they have a speech impediment or, something like apraxia, that definitely affects their ability to speak vocally. So at the very least, for those children, we want them to be able to express their needs in whatever way they can. As a basic human right, you have to be able to tell people, some of like when you're hungry and tired and all of that. For others, they might have some vocal speech, but maybe it's not clear, so not everyone understands it. Or maybe they, have difficulty coming up with the right words. A device can really help supplement their vocal language, especially for those who are visual learners. Being able to see what it is helps them kind of tell you what exactly they want, even though in their head they might know what it is, they might not be able to actually say it out loud. So that device kind of is that little bridge to gap that. Because the device repeats the word every time you press an icon, they hear it every single time. It's a machine, so it says the word the same way every single time. So it's actually more consistent than if we're prompting them to say the same word.
Yes.
The other issue with us prompting them is that they're dependent on us to tell them what to say. Whereas this device, it's there and they can use it spontaneously and as independently as they need to. So we've actually seen that, a device increases a child's vocal language because of all these extra factors. And just because we're using a device doesn't mean that we're not still working on their vocal language. It just means that, they're able to get their needs met while we continue to practice and work on their vocal language.
I love what you said there, is they getting their needs met while we're practicing their vocal language. And practicing vocal language when you have an apraxia, which is a speech motor challenge, takes time. My son David, who's 20 and has autism, had probably the worst form of apraxia. And because we gave him a communication device, it did not mean that we ever gave up on his vocal speech. He is capable of saying some words vocally, and he uses some words vocally. They have to be very simple, short words that he can say vocally. He even acquired certain vocal words when he was 12 and 13. I'll never forget that he could only say S and the sound sh, SH, when he was 12 and 13 actually. And when he could do S and SH, then we could practice words like C, or one of his instructors, her name was Ashley, so he could call her Ash. But he had a communication device in place for many, many years, and he can tell us many, many, many things through that communication device. You probably have many stories to share with us, but we had a child that we worked with who was completely non-vocal, really also very severely severe apraxia. And this child did so well with the communication device that he was coping with the foundation phase academics at school. We would facilitate him at school. He could handle a grade curriculum successfully and have a beautiful conversation through the communication device, even though his vocal speech was so impaired. He would tell them about dolphins, and he would tell them about what he thought about dolphins swimming in the sea, like a high-level conversation through a communication device. My son David doesn't have that high-level conversation through a communication device. He'll only communicate for his basic needs through the device, but he still tells us a lot of things, like where he wants to go on holiday and what he wants to do on holiday and what he wants to eat. And he'll ask me on the device things that matter to him. When is his dad coming home? They all love their dad. I'm the sergeant major. I run an army camp in my house. They've all accepted that, but they love their dad. So he'll be like, where's Martin? And he'll ask on the device, and he'll tell me about B movie that he's watching, and he'll say, hi mom. He'll say B movie, and then I'll put it on, and then he'll say the bee got stuck on the ball in the rain, and he actually types that on his iPad, which is, quite a sentence. He does, though, like I said, only tell me about what interests him, but he really knows how to elicit a smile from us, because sometimes we really grin at what he's able to tell us on the device, and we wouldn't know what's going on in his mind if he didn't have that means of communication. So it's very important. And like you said, we never give up on vocal production. We really don't. And an ABA program is always going to cover that motor piece, that is that apraxia piece. When we walk, we motor plan. When we speak, we motor plan. So we have to practice the oral motor under the motor area. We have to, get the kids to echo the different sounds, blends before we get to words. And yeah, I agree with you. Once you give them the iPad is a machine that says the word the same way every time. And research shows that children actually acquire vocal speech much faster when you give them that communication program. And one more thing with a communication device, if you're 3 years old and you can't say, leave me alone, or I want to go to the toilet, or can I play in the garden, you're going to engage in inappropriate behavior like hitting your head, kicking, biting, spitting. So the sooner we can put that device in place, we're going to prevent those kind of behaviors from emerging.
Yes. And then, the later, it's never too late to work on it, but the later you put a device in place, the longer the child has to learn that those problem behaviors are going to get them what they want, which means that it's going to take a little longer for them to unlearn that behavior and relearn how to do it a different way using that device or vocal language if it starts to emerge.
So I agree with that, because I'll speak to parents of a 10-year-old and they'll say, well, how long will my child have to be on the program? And I'll say, well, he's now engaging in XYZ behaviors. He's been behaving in this way for 10 years. It's going to take a lot longer to undo those behaviors because he's been behaving in that way to communicate for a very, very long time. So it takes much longer when they're older to teach them a replacement behavior. Not that it can't be done, it absolutely can be done. And ABA is relevant to all children across the spectrum, which brings me to the next question, which was, how do you address social skills deficits? Can an ABA program improve a child's social skills?
Yes, we absolutely can work on social skills. That's one of the main deficits of autism, right, is that the child has a lot of social deficits. Social skills is hard enough for a neurotypical person, let alone, someone with autism. Neurotypicals learn through observation, whereas those with autism might need to be taught these social skills directly instead. So we can teach social rules that many autistic individuals do well with. They do really, really well when it's black and white and it's presented as a rule. We can also break down like a complex social skill into smaller components and then, teach each component of that social skill individually, and then, have them kind of put it all together once they've mastered all individual components. We can also, just be a safe place for them to practice their social skills, so that when they are around their families, peers, and out in the community, they, they might not be as nervous to use whatever skills that they need to use. So the end goal is always for them to be able to apply their skills in the natural environment. So, that's what we also have to kind of plan for as well.
Every time I show a parent the social skills domain in the skills program, I get excited because it's going to teach your child about how to pick up social cues, how to start a conversation, end a conversation, initiate a conversation, learning through observation, how to make a joke, how to take a joke, understanding the intentions of others, learning social rules, what is appropriate to do at home, what's appropriate to do out in the community or at school. The social skills curriculum in the skills developmental curriculum is extensive, and it really goes a long way to address social skills deficits. Now, children with autism can be picky eaters. I know you also speak to so many moms who are pulling their hair out because the kids kind of get your back up in a corner because they'll like McDonald's,
Yes.
and they will just not touch any nutritious food. And we know that nutrition is so important for children on the spectrum. Correcting vitamin and mineral deficiencies is critical to treatment. So how can an ABA program address these challenges?
So yes, first we want to make sure there's no medical reasons for it. Whether there's, just sometimes like speech, there's some like speech delays and things that are caused by medical reasons, and same with like feeding, whether it's, not being able to chew a certain texture, or whatever it is. So we have to clear that, rule that out. But then after we've ruled that out, we can work on desensitizing the child to specific textures, smells, colors, types of foods, all of that. And again, work on it slowly at it, like, just do it slowly. It's that desensitization where, the way I usually teach it is that they just have to be okay with it being on the plate. It depends on how intense, their aversion is to the food, but sometimes it's just starting with it being on the same plate. And then we work on, them being able to touch it, and then being able to, pick it up, put it close to their nose and smell it, put it close to their mouth and just like outside of their mouth or on their lips, then lick it. We work our way slowly up to them being able to take a bite of it. Throughout all of this, they're getting reinforced by their preferred foods. We want to condition them to learn that, when I do this with a food that I don't like, I get a food that I like. And, over time, your brain does learn to associate, the two foods together. And hopefully, that will help them eventually pick up at least a wider range of foods and not be as picky. They might not be able to, just eat all kinds of fruits and vegetables in all food groups, but hopefully it's expands the horizons enough to where they're eating enough different types of foods, or, be willing to try different types of foods more willingly without getting so upset.
That's such a good explanation. And we've had a lot of success in our ABA programs in introducing children to new foods. In fact, today I was speaking to a dad whose son is enrolled on our program. And he said, Ilana, I just want to thank you because we can now take our child for a haircut, actually. He said that you were working on desensitizing him. He was very afraid of the clippers. And so in the ABA program, we got a pair of clippers and we just let him touch it and play with it and tolerate it just on his skin. And then for longer periods of time. And in an ABA program, no matter what the challenge is, we can work on desensitization. And that's a piece that also comes in when we help the children to learn to eat a variety of foods. And this is a huge piece. It's a huge piece because part of the reasons I always say that we're seeing autism symptoms, and the research shows, is because they are deficit in essential vitamins and minerals that they need for proper brain function. That if you can't get your child to eat, what are you meant to do? And so meal times really does need to be a pleasant experience. My oldest son, David, he used to hold us hostage. So he used to eat, if we presented something he didn't like, he'd throw up. And then I'd clean it up and I'd have to cook the food again and I'd present it again and he'd throw up again and I'd present it again and then he'd throw up again. Cleaned a lot of vomit in my time. I could get the badge. I know how to clean vomit. I cleaned a lot of vomit, but we persevered, and I learned from, CARD and the clinicians I was exposed to over the years that meal times really should be a pleasant experience. So I found it very reassuring to know that you can actually rely on an ABA program to systematically and very strategically introduce new foods to help the child eat a better and more nutritious diet. Now, potty training, big one. Will my child potty train? I always say to the parents, we will get them to potty train. Tell us more about potty training.
Yeah, so potty training is one of those milestones that we want all of our children to hit. There are a lot of prerequisite skills that come in or that are required to make sure the child can successfully potty train. So we want to make sure that the child has those prerequisite skills first. Some things is just making sure they're able to stay dry for at least an hour. Start to show, like, be able to sit on a toilet, even if they're not able to potty train, make sure that they're able to, like, that compliance of being able to sit on the toilet, so we can even successfully toilet train. So we want to make sure they have those prerequisite skills. Two, before we start, we want to make sure we have a meeting with the parents to talk about what the right toileting procedure is for the child, because again, every child is going to be different and every parent is going to be different. What might work for one child isn't going to necessarily work for another, and what one parent can do doesn't necessarily mean that another parent can do. So we want to make sure everyone's on the same page before we get started on it. Making sure the schedules, we're all on the same page with the schedule. We have a reinforcer in place. Everyone understands, like, how to implement it, because we do need that consistency during the first week or two of potty training. And then, ideally we'll be able to get it done within that week or two, and then, be able to move on to a less intense potty training schedule and routine. But yes, it's absolutely something that we can work on in ABA, but it is very intense. One of the most intense procedure or protocol that we can do.
Mm. My son David, who has autism, only potty trained when he was 7. And that's when I actually met Dr. Doreen Grant-Boucher, who's your founding director of the Center for Autism and Related Disorders. And she sent of the card clinicians to South Africa, and they helped potty train him very, very quickly. I always say, if David could potty train, then any child can potty train, because he is profoundly autistic. And I do agree with you that, again, that's where the skills curriculum comes in, because those prerequisite skills need to be in place. And it really depends on every individual child, because with some children, they can be afraid of sitting on the toilet, and you have to maybe start on a potty. And so I think it's so wonderful that we can have a case supervisor, or in your case, BCBAs, that are actually, working on this. It's just simply amazing. And I think the bottom line here and the message is that ABA is working towards teaching children functional skills so that they can become independent human beings.
Yes, exactly. Exactly. And, the skills program is very, like you said, very crucial in determining that. But I also think thinking about the function of the behavior is also important. Like, why is potty training difficult for a child? Because if a child is scared of sitting on the toilet, how we would approach that is different than a child who just doesn't understand the concept of going in the bathroom as well. So
Yeah.
I think that's all very important for sure.
What was so comforting for me when I had my ABA team to toilet train David is that I had this whole team of people working towards achieving David's potty training. So yes, that's really what you're going to get when you enroll on an ABA program. Now, parents don't always want to remove their child from school and place them in an ABA program instead. They feel that they need interaction with other children. Which prerequisite skills need to be in place in order to ensure a child's success in a school setting?
Yeah, I would say the top priorities are compliance, having those basic compliance skills, and also having enough receptive language skills to be able to understand the instructions so they can even comply with the instructions. Being able to work on their attention skill, for them to be able to sit and focus on the teacher or the lesson plan or whatever it is that they're working on. And then have a way to communicate their needs as well. Those are all the main priorities that they would have to, or the main prerequisite skills that they would have to have, that we would like to see before a child go into a school setting. And the quickest way to teach the skills would be in a one-on-one setting, which isn't always possible in schools. Another thing is, if we want to make sure they can engage, or they can participate in peer play. If a child is aggressive towards their peers, putting them into a school with the peers isn't might not always lead to the best results. So we want to make sure we're working on decreasing those problem behaviors as well, so they can build a relationship with their peers. At the end of the day, our goal is to teach them the skills to be successful in schools and not to keep them out of school. It's just that, again, sometimes they have to work on, those skills before, we get them to that point.
Yeah, I agree on everything that you said. With my youngest son, Aaron, when he had the prerequisite skills in place, we would then send a trained facilitator with him to school. And that's where we implemented his ABA program at that point. So ABA can really be implemented in different settings. I also agree that if a child requires one-on-one facilitation, they do need time one-on-one so that we can teach those skills that they need. When you're in the classroom, you can then work on the generalization of those skills, correct? But you do need that one-on-one time. With 2-year-olds and 3-year-olds, I also think what's important is just getting their imitation skills in place, because a 2-year-old learns because they imitate their peers, right? And so if their imitation skills are not fluent, they're not going to be successful at school.